It is an honour to be here in front of you all this morning as we gather again for the 2021 CNSA Annual Congress. It was just 3 years ago that my sister Kristen and I were here at the Brisbane Convention Centre, and some of you who were also there may remember Kristen from the panel discussion about cancer patients and financial toxicity, or her presentation about the ovarian cancer educational program Survivors teaching students. Kristen was my little sister, and she was diagnosed with ovarian cancer at age 21. Throughout the 6 years that Kristen fought the disease, she endured continuous treatments, clinical trials, multiple surgeries, and radiation. However, she also managed to find the time and strength to become a fierce advocate for ovarian cancer awareness and funding. Kristen volunteered extensively, sharing her story at events across the media and even launched her own podcast series. There was a lot of uncertainty over those years, spending much of our time in hospitals and oncology clinics, and at times it became incredibly challenging to navigate each hurdle as they arose. The path of advocacy is a continual learning curve, and we found we needed to apply these skills to advocate for Kristen's healthcare as well. As you would have all witnessed, treating cancer is not one independent task. Cancer comes with side effects, complications, emotional and financial impacts. For the patient and their families, these experiences are often a first for us, and we don't know what we don't know. There were countless instances over the years when the nurses involved in Kristen's care would take the time to talk to us, ask us how we were travelling, or if we needed more support, additional resources, or access to certain services that might be available to us, and then often going that extra step to help organise the necessary referrals for us. Living with cancer can still be joyous, filled with happy times and travel and adventure, but particularly in the darker times, when things aren't going to plan, sometimes it's hard to advocate for yourself. Times like these, we appreciated when Kristen's nurses recognised this and took the lead in making new arrangements so that Kristen could be as comfortable as possible. This could be finding a quiet room with a bed, or turning a blind eye so that Kristen could receive visits and cuddles with her beloved dogs. Kristen endured things that were frightening and painful, from chemotherapy that gave her allergic reactions, to surgical wounds, pleural effusions, or numerous NG tubes. However, during these times, we always took comfort by those nurses who put us at ease, that Kristen was being monitored and treated with the utmost care and compassion. Without the kindness of these actions or conversations, we would have felt even more lost in this space. Kristen was very much a people person. She valued human connections and wanted to build a rapport with others. We knew that nurses are always busy, but the care and attention that was paid to Kristen and I, in listening to our concerns, imparting advice, or finding the information we needed, was so appreciated. It should never be discounted the impact and improved quality of life that can come about by speaking up and offering that extra something to a patient. It truly can make all the difference. I would like to wish you all an inspiring and engaging Congress and the wonderful opportunity to catch up with and meet new faces over the event. And thank you for all that you do.